Hey guys, Oscar here with Gastroenterology Simplified. I'm a board certified physician assistant, and today I'm going to bring a very raw video about a topic that I do not think many individuals understand out there. And today we are going to be talking about GLP-1 medications, adverse effects that are overlooked. I see it on the daily basis. And I also want you to understand that the way I practice, I'm in the acute setting. So I usually see the worst of the worst. So keep that in mind, okay? Because I'm coming from the perspective of what I see in the hospital on the daily basis. And I'm in the acute setting, so therefore I'm going to see some of the adverse effects of medications or the worst of the diseases. And today I want to talk about the GLP-1 medications, the most common adverse effects that individuals are experiencing. I believe they are overlooked. And a lot of individuals are not understanding the adverse effects of the GLP-1 medications. Something that I truly do not understand is that, and this is coming from my perspective, is that we as humans, we try to reinvent the wheel over and over and over and over. We know that losing weight or a weight loss journey, 80% of it comes from a proper diet. 20% of it comes from eating healthy, having a healthy, balanced diet. And something that I see at least on the daily basis is that individuals are using a medication to assist on weight loss. And I quote, some of the patients are telling me, well, my doctor kept pushing the medication because of the great benefits of the medications. And that's what my patients are telling me. So I'm not sure, and this is, once again, this is just me. I'm not sure if this is true or not, but I feel like the individuals are being given this medication, the GLP-1 medications for weight loss, and they're selling them with the good benefits of the medications, but they are overlooking the adverse effects of the medications. Once again, my name is Oscar. I'm a board certified physician assistant. And if you have any questions, concern, always talk to your primary care physician, your physician assistant. If you have any symptoms, always talk to your physician assistant or your primary care physician. So let's go ahead and get into this. GLP-1 medications, to be more specific, GLP-1 receptor agonist, for example, semaglutide, liraglutide, tirzepatide, are generally well tolerated, but clinically relevant adverse effects are frequently under-recognized or misattributed. For example, and I'm going to go for what I see on the daily basis. I'm going to give you 5, and at the end, I'm going to give you a bonus one. And let's go from the one that I see the most and so on. Number 1, delayed gastric emptying. This is clinically significant. So the GLP-1 medications slow down the gastric motility, and therefore it gives you early satiety, which is you feel full early. And this is how you lose weight, because you get full, early on, you don't want to eat anymore. Therefore, you have less calories and you lose weight. Now, the symptoms give you an unrecognized gastroparesis-like symptoms. Gastroparesis is the slowdown of the GI system. It slowed your GI system very, very slow. And this gives you early satiety, which is feeling full earlier on, bloating, nausea, some vomiting, and this happens and stays persistent hours after eating your food. This can also mimic functional dyspepsia, where you have this like GERD, belching, and so on. And the reason this medication has to be held 7 to 14 days prior to any procedure is because the risk of aspiration. Your GI system, your stomach becomes so slow that the gastric content stays there, and this could go up and you aspirate, and this happens when you are sedated during a procedure. Number 2, sarcopenia, the loss of lean muscle. So the weight loss with the GLP-1 medication is not purely fat. Up to 25 to 40% can be lean body mass. If you watch TV, if you watch any advertisement, you're going to see many Hollywood stars that they have this face that is pretty much flat down with no muscles whatsoever. That is the loss of muscle mass, not purely fat. And this is very risky. For example, the risk factors are low protein intake, sedentary lifestyle, and in older adults, this could cause further problems, such as not being strong enough, and this could reduce the metabolic rate in long term. So the medication is helping you with the weight loss, but the individual is not losing weight, just fat. They're losing lean muscle mass. And in an individual that was already sedentary, not strong enough, losing muscle mass is going to end up affecting them even worse. Number 3, subclinical dehydration. Reduced appetite leads to the decrease of fluid intake, and the decrease of fluid intake causes nausea, causes further symptoms of gastroparesis, feeling sick, electrolyte imbalance, and this could give you mild acute kidney injury, especially in the patients with ACE inhibitors intake, blood pressure medication, or individuals that are taking diuretics. So let's go ahead and understand this. The patient has a decreased oral intake. The patient is not drinking enough, is taking a medication that could affect their kidneys. They're not drinking enough, so their kidney are going to be affected. And if the individual is taking diuretics, which is the water pill, known out there as the water pill, which gets rid of excess fluid, this is going to further cause dehydration. This is so overlooked. And this should be like number 2 instead of number 3. Anyways, let's go ahead and move on. Number 4, this is another one that I see so often. Gallbladder disease. Beyond just gallstones. So it's not just gallstones or cholelithiasis is biliary sludge, biliary dyskinesia. What is biliary dyskinesia? Biliary dyskinesia is the improper ejection fraction of your gallbladder. Your gallbladder squeezes to let the bowel out, and this doesn't work anymore. Therefore, it gives you nausea, vomiting, abdominal pain. And this is how it works. Rapid weight loss reduces the gallbladder contraction. And the repeat of the rapid weight loss and the reduce of gallbladder contraction can present as follows. Vague right upper quadrant abdominal discomfort or pain, rather than the severe right upper quadrant abdominal pain with some nausea, vomiting. So keep in mind, this is only number 4. This is only some of the most common adverse effects that I see on the daily basis on individuals that are taking the GLP-1 medications, as previously stated at the beginning of the video. And last one, this one is something that I see very common and very often as well, which is constipation. And this is so underrated. This is very persistent constipation rather than diarrhea. The GLP-1 medications causes the slowdown of the GI system to begin with. I said it earlier, the gastroparesis, the slowdown of the GI system. If it slows down your stomach, it also slows down your small intestine and your colon as well. So this could lead to a slowed GI transit, which can lead into hemorrhoids, anal fissures, and the patient that is taking this medication could be misdiagnosed with IBS constipation. And in fact, the patient may not be experiencing IBS constipation to begin with. It's actually the adverse effect of the medication causing the slowdown or the slowed GI transit of the stomach, small intestine, and the colon. And it's going to end up, the patient is going to end up being misdiagnosed with IBS-C, IBS constipation. And I have a bonus one for you. This one is one that not too many people mention, but I'm going to go ahead and give it to you. Drug absorption issues. Due to the delayed gastric emptying, the medication that you may take, whatever your medication that you're going to be taking, this is going to alter the pharmacokinetics of the medication. For example, oral antibiotics, thyroid medication. We all know that thyroid medication is very, very tricky to dose. And with symptoms of gastroparesis, this could be an issue. For my females out there, oral contraceptive. This may not make the oral contraceptive pill effective enough. And I have not heard this quite often because I'm not in the area that the possible young individuals, or how can I say this, the people that could be pregnant could come in for. But I'm sure there are many individuals out there, many females out there, that they could have gotten pregnant while being on the GLP-1 medication. And likely This is because the slowdown of the GI system, which alters the pharmacokinetics of the medication, therefore making the medication not work properly, and sometimes make the medication not be effective. So, in conclusion here, I guess as medical providers, as scientists, as the pharmacists or the companies that are creating the medications, I think we are trying to reinvent the wheel at all times. Reinvent the wheel. And something that we are not pushing out there, which should be pushed, number one, should be the first thing we do, no matter what, should be eat properly, lifestyle change, eat healthy, and work out. Walk. Walk is so important. Walking, eating properly, healthy lifestyle. We are not pushing that out there. You know what we should be doing? I'm going to go ahead and say this. Instead of prescribing this medication like it's candy, yes, here we go. Here's this medication. Instead of prescribing this medication like candy, I think we should be sending the patients to a registered dietitian as often as possible. Educating the patients on this is the best route you should go to accomplish your weight loss, to be healthy. I'm sure if people are educated when it comes to proper food, proper mobility, all I'm asking is for walking. That's it. That's all what I'm asking for. Just walking. If we educate and take the time to educate every individual out there when it comes to the proper way for weight loss, instead of selling this medication like candy and selling this medication with all the amazing effects that this medication should have, instead of doing that, we should go ahead and say, hey, do this, do that. It's much better for you. I'm sure if you give it some time, I'm sure someone experiencing metabolic syndrome could cut down the risk of furthering and worsening metabolic syndrome by eating healthy and proper workouts. I'm going to go ahead and give you a personal experience because I'm not here to sell you anything. In fact, all the information that I'm giving you is here for you for free. I went to school for a very long time and I'm giving you the information for free. My experiences, I'm giving it to you for free. I recently had my annual medical appointment with my primary care physician. So I go to a new clinic, which is closer to my house. Go, how are you? How you doing? You taking medications? No. Hey, you do this, you do that. Oh, no. Very simple. The doctor doesn't even palpate anything, doesn't even listen to my heart, doesn't do anything. Said, okay, have a good one. Bye-bye. I can't believe this. I just can't believe it. What happened to the old days where we listened to the heart, we listened to the stomach, we listened to the lungs, we looked inside of the ears, looked at the eyes, inside of your mouth, your throat. Take a look at your dental health. Whatever happened to those days? So I guess that is loss. I guess that comes with the virtuals or telemedicine that is going on out there, but I went face to face to see my primary care. Guys, this video is getting a little bit too long, but I wanted to bring the most common adverse effects that I see almost on the daily basis when it comes to the GLP-1 medications that the people are taking out there. Let's not reinvent the wheel. Let's not do that. Let's go ahead and do the proper thing. These medications are very, very new. And in 10 years, 20 years, we are going to see the true adverse effects of this medication. And I hope I'm wrong. I hope that the medications are actually doing something good. But for what I see a lot of negative adverse effects that individuals should be further educated out there. If you found this video helpful, informative, please don't forget to follow Gastroenterology Simplified for clear and simple medical education. Lastly, all this is free. I'm giving you free information, free education. I hope you take advantage of it. Click like, subscribe, and share this video to anyone that may benefit from all this. All right, I will see you in the next one. Bye.